The three most common that most people have heard of are basal cell carcinoma, squamous cell carcinoma, and melanoma. Basal cell carcinoma is by far the most common, and it tends to be the least aggressive. Basal cell carcinomas tend to grow relatively slowly. They can, however, start to destroy tissue or vital structures as they approach those areas. So you can imagine a basal cell carcinoma on the back could potentially grow a little bit larger before it started to damage things, as opposed to one on the eyelid, where it could really start to impact the eye or impact your vision. Squamous cell carcinoma is the second most common type, and it is a little bit more variable in how aggressive it can be. Many times in otherwise healthy patients, squamous cell carcinomas tend to behave almost similarly to basal cell carcinoma and can be easily treated. In some patients, especially patients with immune compromise, whether they may have a blood disorder or even more typically transplant patients, squamous cell carcinomas can actually grow very rapidly, spread to other parts of the body, and become life-threatening. So it's very important to treat them in those scenarios. The third type of, most common type of skin cancer, melanoma, is one that can definitely be more aggressive. It has more of a tendency to spread, to leave the skin and spread to other parts of the body, such as the brain and the lung. And really how the potential for spread is really based on how early it's diagnosed. And so melanoma that's diagnosed very early tends to have an extremely high cure rate, well above 90%. As it has time to invade deeper into the skin and has that increased potential for spread, the cure rates drop very substantially. And so with all of these skin cancers, especially with melanoma, the most important thing is that we are able to diagnose and treat the lesions early. Not usually every single day, because we know if you look at something every single day, you really have less of a tendency to notice subtle changes. And so you want to pick a time that's spread out a little bit. So once a month is typically very good. If you notice any particular changes that are concerning, those are things that you bring to the attention of your physician or general physician or dermatologist.